with, you're playing music. Dr. Mark Vaughn and Dr. Gwen Vaughn. Dr. Gwen Vaughn's phone apparently is getting in on the action.
Yeah.
So thank you for joining us. We will take calls, live calls. We're set up for, let's get that set up.
Oh, yeah.
So I'm setting up right now so that we can get Skype calls. If you Skype to the user ID in the description for Markman MD, and you have to get all the punctuation correct, then we'll actually take your call. Well, as soon as I get Skype up on the phone, then we will. Okay, so now that Skype is up, you can call with your questions about
nature.
Today's topic, nature calls.
Maybe not those types of calls, but your nature calls.
This show's all about nature calls.
Interesting.
Hadn't thought about that. I called it nature therapy, but I didn't think that we'd be having live calls, which in effect would be when nature calls. So
anyway,
if that's what your medical question is about, maybe we can address it too.
Right.
We'll just say that. So tell us a little more about, Dr. Quayne, tell us a little more about your...
So I actually was listening to a podcast a little while back, and they had somebody on there who had done a fair amount of research on getting out in nature and the benefit that it is, and all of the studies that have been done recently on its therapeutic and medical benefits. So I decided to research that a little more. I looked into some of those studies that were being done, and I wrote a little blog post on it, which you can check out at drgreenknight.com, drgreenknight. Check it out. It was a good one. Lots of research in there. I cite a lot of articles because this has now been well corroborated, well documented how well nature or how much nature can affect your health in a positive way.
So, in a positive way.
Yeah.
Nature can be positive.
Yeah, and I know as a kid, or at least when I was younger, I'd go out for hikes or go off to youth summer camp in the middle of the woods, and I'd come back feeling better and refreshed. And I always thought it was just getting away. But apparently, being close to trees and nature has its own therapeutic benefit.
There's something real there.
Yeah.
Yeah, there is.
So, so people start
actually getting calls.
Tune in.
Not getting the Skype call.
People
Let me make sure we're called. Let me make sure it's all. We'll hear it if it comes in.
Yeah. Let's see. Petra Russell, Kiko Mo.
No calls yet.
Anacito, Denise, Bonnie.
Yeah, if you
want. Hello to all.
If you see the user ID for Skype there in the description, and you want to call in, voice call into Skype, so we can actually have your voice on, asking your question, go ahead. But until then, a little bit more about your data for supporting that nature is a good thing.
Nature is a very good thing.
Nature does call.
Nature, yes, and when it does, you should answer.
So true.
So let's see. Helps psychologically, helps with depression, anxiety, ADHD, sleep, all of those things.
That's a lot.
That is a lot.
That's a lot.
Some serious things there too that sometimes require serious medicines that nature can help us with. Cardiovascularly, so high blood pressure, it helps out with that. Diabetes, it helps out with that.
Wow.
What else? What other things? I mean, getting out and walking is good for your joints and muscles. Light therapy, good for all those psychological things. Breathing in nice, clean, fresh air is good for you.
Yeah. And
they actually asked the question, why is this happening?
Why is this happening,
Yeah, that's what they asked. And apparently, I didn't know this, but trees and nature, vegetation, they release these things called phytoncides. I think that's how you pronounce it.
Phytoncides?
I didn't know about this. That are actually they actually have
sounds like something
benefit when you bring them in. Yeah. And you bring them into in your system. They have a lot of good things. They can increase your natural killer cells in your body. Those are a white blood cell that helps remove infected or tagged cells. So infected cells, cancer cells. Not saying that nature completely cure cancer. That's not what I'm saying.
Cells. Are those CD?
No, they're completely separate from the T cells.
Are they lymphocytes? They're not T cells.
No.
Are they lymphocytes?
No, they're plasma cells, I believe.
Okay.
Yeah. Yay, going back to...
I should know what natural killer cells are. So
that's one that you don't just hear.
You're learning with me.
You don't hear much about them. So, yeah, natural killer cells are the ones that will attack cells that are targeted by antibodies. So antibodies will attach to cells that are defective.
A type of white blood cell.
Or infected with viruses, and they'll find those and kill it.
Okay.
So, yeah. The phytoncides, they came up with this. There's also apparently a mycobacterium that is beneficial for your system called Mycobacterium vaccae, I think is how you say it.
And a mycobacterium is not a fungus?
No.
Okay.
No.
Type of bacteria.
Let me see if I can find it. I'm looking through my... but yeah, they had all these different pathways, obviously.
Mycobacterium.
Increased better air. They said negative ions within the air are good
Negative
for your
ions?
system. Yeah, that was interesting. I didn't know that.
Isn't
but
that
I
what
put it in
people
there.
get from those air purifiers in their homes?
That is what they get.
Make negative
Is
ions?
it as good as nature? Probably not, because you don't get all
Do
the
you
other
get static
stuff.
electricity with those things, negative ions?
That would think you would
Because
think
they're
that
electrically charged.
it would build up, huh? Maybe it's just so subtle that you don't feel it.
Maybe usually it's positive ions, and so it's just,
And it's just
countering, and you have
counteracting those?
less static electricity. I don't know. Somebody definitely call if you have a problem with
if you know
static
that.
shocks when you.
And it's actually mycobacterium.
Okay.
Is that what I said?
Yeah, you said mycobacterium.
So mycobacterium is tuberculosis as well, right? Tuberculosis is a mycobacterium.
Oh, what are we getting here?
We're getting a call?
No, it's your brother.
Oh.
I'm going to ask the question since no one else will.
All right.
Okay, Jonathan, we prefer that you use the Skype and we could hear your lovely voice, but we'll
Hey,
go.
all right.
We'll go with your text anyway. Okay, so Jonathan says, "Oh wait, I lost it. Where'd Jonathan's comment go?"
Thanks for catching the
Okay, this is
the
from
live
Jonathan.
YouTube.
Yes, Jonathan, thanks for watching it. He says, "Did we eat something last night that had green food dye in it?" Oh my goodness. And
Excellent.
Our live YouTube to people who watch it.
Yeah. That's awesome. Thank you, Jonathan. Thank you for that.
Oh my
Thank you for
goodness.
bringing up the greenery in a different...
Thank you for ruining our live YouTube with that memory from how many years ago?
Anyways. Hey, Denise George says, I have to agree. I moved from the city to rural Australia, and I feel better. My kids are leading a much more outdoor life.
So Denise in Australia,
Hey,
she's,
all right.
she's experiencing the benefit. So would that be considered the outback? Because there aren't a whole lot of trees in that desert part of...
I don't know. I guess let us
Denise, let us know. Denise, is that right, Denise?
Yeah, Denise.
let us know.
Please let us know. Educate us.
Now, I know
we
that
are
there's trees
dumb
around
Americans.
Sydney.
Yeah.
But that's all I know is Sydney. Sorry.
That's all.
You got a
That's
whole
it.
continent. That's all
That's
I'm
it.
giving you is one city. So
Stupid Americans. Sorry.
stupid Americans. There's more to Australia than just Sydney. And I'm guessing they have trees down at Melbourne too, but I don't know.
Bonnie says, TMI, bro. I'm pretty sure she was referring to
Referring
Jonathan.
to Jonathan. Do you think she
That's
knows?
awesome. Thank you. Thank you for that. Yes, mycobacterium is for TB. Yes, it is. You're right.
Mycobacterium tuberculosis, Mycobacterium
Avium-
intracellular,
Avium-
MAI,
Yeah, Mac.
is a pulmonary infection.
Right.
We see a lot with
We do see that a fair amount.
HIV is where it's really bad, isn't it?
Yeah.
Or am I thinking of,
But we,
what am I thinking of that they take the Bactrim as prophylaxis for when they have HIV? Not MAI, but not psittacosis.
Nope. This how many HIV
That's
patients we see?
parrot fever, right? Psittacosis.
Yes, with a P.
Yep.
PS. Anyways.
Not necessarily from parrots, but something along. Oh, pneumocystis carinii.
Yeah, there you go. PCP.
PCP. Pneumocystis carinii. What's the P stand for then?
Pneumonia.
Ah, there you go. Okay, but that's not mycobacterium.
No, it's not.
Okay. And mycobacterium you see in people with competent immune systems.
Yes.
Mycobacterium intracellular.
Yes.
Okay.
Yes.
All right. Well,
Yeah.
Good.
Let's see here. Denise says yes-ish. It's
Yep.
really red.
It's really red.
So not green, it's red.
Kind of like the dirt in the canyon. It's
Oh,
really
yeah.
red. Okay,
Arizona.
so it's at this time in the show when I will do something for someone who's might be watching.
Nice.
And no, for those of you who don't know what this is,
We were not compensated, but it'd be great if we were.
we certainly aren't. Absolutely not. This This is not a hat that's supposed to say sign or coin, excuse me, that's written by somebody with dyslexia. That is not what it is.
Oh, I never even made that connection.
All of our cinephiles, video production people out there will get
They
this.
will know.
but,
Yeah, they know that reference.
A certain,
Did you mess up your hair?
Certain
Oh,
company,
okay.
yeah, my hair is really messed up. Certain company in Grass Valley,
Grass Valley, local.
they'll recognize.
They're
They'll recognize that.
20 minutes up the road.
Two people watching this will know what that was.
Let's see. Daniela says, when I go to our family farmhouse, I find that our family comments on how well we get to
Get to what?
how well we get to feel in compared to city life. We go at least 3 times a month. Oh, excellent.
Well, good.
That's great.
There
that
you
you
go.
have, that access.
You're experiencing. And I don't know how much of this is psychological. I think that's a part of it.
I'm sure it is.
Yeah.
Getting
It's kind of hard
away
to do
from
it. Hard to do a placebo-controlled trip to the country.
Yeah.
Not sure how you do that. Okay, we're putting on these blindfolds and you're getting in the van and
Yeah, most of the studies that I read
Putting in
were
earplugs so you don't
basically
hear
just
traffic?
retrospective, looking at people who lived in the city versus those who lived in the lived in the country, or those who would go out to the country and then they'd come back and do like blood tests on them and stuff like that. So no, it's not like a blinded study. No, you can't really do that with this.
hard to do. So
Yep. Bonnie says, I live in the burbs.
in the burbs.
Nice. And I think that says,
Thanks,
need to
Bonnie.
find somewhere more scenic to go walking. Absolutely.
Yeah.
Even a
Park.
is good enough to get the effect. If you go to a park and walk around there. Yeah, and cities are actually starting to realize this, that they're putting in more parks.
More green space.
More green space. It's good for
Hey,
you.
those of you in the Bay Area, have you seen that 5-acre park on the 3rd story of the new Interbay Transit Terminal, I think it's called, by the tall building? What's it called?
I
The
don't know.
Salesforce Tower.
I don't know.
That is cool. Salesforce Park, I think is what they call it.
Oh.
5-acre park,
On top of
3 stories up with redwoods and everything. If you ever get to San Francisco, check it out. It's kind of cool. Well, if they fixed that beam that had a crack in it last week, that they closed it for. I haven't heard that they opened it back up yet.
I'll have to check it out.
Engineers thought that was
I'm
something
going
to
down
check
there
out.
this
Oh
this
yeah.
week,
You and James should check it out.
We'll have to walk over there.
And John too.
Yeah.
Get John. I don't think he's been up on it.
Real Ruler has a joke for you.
Real ruler.
Why did Dracula go to the doctor?
Why did Dracula go to the doctor?
He couldn't stop his coughing.
What's becoming of our show? I keep looking over here to think there might be a Skype caller. There might be.
Outback. I told him about Truckee.
I think we might be temporarily disconnected here. So,
can you see
are
us here?
are we back where we left off? Let us know in the comments if we came back, because according to this, we didn't make it back.
Real Ruler says, I've got green carpeting in my living room.
Well, okay,
Does that count? Nice.
At least that's something that you can have a placebo control for.
Yeah, there you go. You could do it with that.
Good. Okay, yes, we're back. All right.
Okay.
Sorry for the computer system, these things. Actually, I got an update today on the system, so you know how that goes when you get new updates on the software.
Daniela says, might be why people feel really great when they go to the beach, because they go barefoot for walks. Now, beaches don't have a lot of greenery, but people feel better.
Yeah, it seemed like you were talking specifically about greenery.
I was talking about nature very specifically.
You were talking about the
phytoncides. I think that's how you
phytoncides
pronounce it.
from trees.
Yes.
Okay. Does it matter if they're deciduous or what's
I don't
the
believe
other
so. I think it's all plant
evergreen
cells, which
or-
would have chloroplasts, which produce
Just
that
plants,
same thing.
just plain plants.
Yeah.
So if it's just red dirt, probably not a lot of
Probably not going to
phytoncides.
do it. I mean, that may have other benefits,
Okay.
like
Just asking.
red dirt.
Red dirt. Truckee. Those people from Truckee.
Yeah.
Those,
Yeah.
what did he say? Meth heads from Truckee?
That's what he said.
He said,
My wife's from Truckee, so this was a...
don't bother being in Auburn, go to Nevada City
yeah.
with an
He
expletive.
was really ripping on us.
And something about the naked statues.
We do have naked statues.
We do have naked
in
statues.
Auburn. Come check it out.
What do you say? Why?
Why? It's a great question, because I don't know why.
What? I think I spoke to...
It was a dentist, wasn't it?
I spoke
that
to
put
Curtis
that up?
once. It's Curtis's dad that made it.
Yeah.
All right.
Anyways.
Just come to Auburn. We have stuff to say.
Back to... Auburn's actually... We've got a lot of greenery. Bringing it back to...
We do.
our
Seriously,
actual
we do. I mean, you got red dirt, but it's underneath a bunch of green trees.
We live right next to the American River Canyon, which has many trails for hiking,
Yeah.
has a lot of greenery.
Yeah, and there's kayaking,
kayaking, go out on
rafting,
the-
and rock
yeah.
climbing, and
Yep.
slacklining, and
And hidden, what is it? Hidden Falls.
bridge jumping. Oh wait, that's not legal.
Yeah, don't do that. We do have the third tallest bridge in America? I think that's what it is.
Is it the tallest in the state? I think?
Yeah, definitely the tallest in the state.
You know, we're not being sponsored by Placer County Tourism here.
We should give this
Beverly
to them,
Lewis.
Yeah, we need a kickback. Come check out Auburn.
She'll probably give me a free film permit for the county,
Let's see.
which are free if you have production insurance.
Yep. Can you please talk about anger management?
Anger management. Wow, we're going to cover that right now.
Well, that's what Donovan wants us to do.
Well,
Go out in the greenery.
Go out in the greenery.
Punch a tree. No, don't do that.
Punch a pillow. Scream into a pillow. Don't do it for longer than about a minute, though, because you really need to breathe.
Yeah, breathing's good. It's
So-
important.
Yeah, some people try to help people with anger management with the pillow over the face, but if you do it for more than a minute, it's counterproductive.
Yeah.
Yeah, so don't
You
do
run
that.
into other issues.
That doesn't help the situation. That's probably why they're angry in the
Counseling.
first place.
Counseling helps a lot.
Counseling.
There are medications.
Particularly,
but-
I'm a fan of cognitive behavioral
Oh yeah, CBT.
therapy,
Very
CBT,
good.
which
Yeah, find
actually
somebody
is
who does
surprising how
that.
much the patient does of that.
Right.
A lot of
Yeah.
insight to how things are going in them. Getting, if you're having anger with a situation, getting away from it, being able to cool down,
Counting 2, 3.
a walk in nature,
Walk in nature, getting away from everything. Yeah.
and then coming back to it, and
Um,
purposely being,
yeah, it's good for you.
okay.
Let's see, what else about nature? Do we hit all the
That's
high
like
points?
the 1 minute.
Yeah, that was very, very.
We crammed
quick.
it in there. So we want to say thank you to our text-in, Jonathan.
Appreciate it, Jonathan.
And I did,
Thank you.
here, just in case he just now came in, I did wear, I want to come on.
What is going on?
I did wear, should I show the brand? I did wear the hat. Paul, if you're watching, see?
Yep.
We'll talk about Sling Studio sometime. Okay, so thank you for watching.
Yep. Go check out the blog. While you're there, sign up. It's just one email a week, just letting you know that I put out a new blog.
It's good. It's good.
And-
There's a link in
yeah.
the description.
Yeah, there's a link down there. Click on it.
Yeah.
Check it out.
Okay. And until next time,
Dr. Gwaine Vaughn.
Dr. Mark Vaughn telling you to stay in good health.
Yep. We'll see you.
All right.